Hello viewers, welcome once again to my YouTube channel, and in this video we'll be talking of the pelvic inflammatory diseases, which is also called as PID. Beginning with, in this video we'll be studying about what is the definition of pelvic inflammatory disorders and who are at the greater risk, what is the etiology of it, and how does it spread. Apart from this, the classification of pelvic inflammatory disorders. Starting with, this pelvic inflammatory disease, it encompasses it is a spectrum of inflammatory diseases which are involving the upper genital tract of the women. So actually, the upper genital tract of the women, it includes the following parts, that is the uterus, the fallopian tubes, the ovaries, and the adjacent pelvic structures. So these are the structures what are involved in the pelvic inflammatory disorders, and the inflammation of all these things are going to this encompasses about the pelvic inflammatory disorders. So when it comes to the inflammation of the uterus, it can manifest in the form of the endometriosis, or it can manifest in the form of myometriosis. Apart from this, the inflammation of the fallopian tubes, it is referred to as the salpingitis. If it is the inflammation of the ovaries, it is referring to the oophoritis, and the adjacent pelvic structures what are involved. So in such conditions, the condition it is termed as the peritonitis. So do remember, viewers, that this pelvic inflammatory disorders, it is mostly seen in such, when we look at the etiology or the risk factors what are mostly associated with this PIDs, it is first, if these infections are actually the sexually transmitted diseases. Apart from this, they can also arise, one of the etiological factors for this pelvic inflammatory diseases, it is the pyogenic infections. So in the pyogenic infections, there is pus forming bacteria, there is pus forming organisms which is going to form the pyogenic infections. Apart from this, they can also be seen in tuberculosis infections, and rarely it has also been seen in certain infections such as schistosomiasis and actinomycosis. So looking at what are the women who are more predisposed to this pelvic inflammatory diseases, so the increased risk has been seen in such women who are young, or who are of a younger age, that is in the age limit of 18 to 25 years. Apart from this, if they have multiple sexual partners, the chances of pelvic inflammatory diseases increases. Apart from this, there are also certain women who are at risk, who are using the intrauterine devices, who are inserting the intrauterine devices insertions, as well as the women who are more frequent to the who are performing the more frequently the vaginal douching. So vaginal douching, the intrauterine device insertions, they are also very important risk factors for causing this pelvic inflammatory diseases. Apart from this, when we look at that, who are the women who are at the decreased risk of it? So decreased risk, actually, to avoid this pelvic inflammatory disorders, one needs to very importantly have that they should use the barrier method of contraception. So women who are practicing a safer sexual process, that is, they are using the barrier methods of contraception, and those who are using the oral contraceptives. Apart from this, if the woman has undergone the tubal ligation procedure, so such women are at a decreased risk of it. And when we look at the organisms what are involved in this pelvic inflammatory disorders, so actually, since it is an inflammatory disorders that is going to cause inflammation, so basically the predominant organisms what are responsible for this pelvic inflammatory diseases is the chlamydia trachomatis, Neisseria gonorrhoeae. Apart from this, there are certain anaerobes, Escherichia coli, and other gram-negative organisms such as the Mycoplasma hominis and the Ureaplasma urelyticum. So actually, when we look at the spread, how this pelvic inflammatory diseases spreads, it can spread either through the lymphatic route, the hematogenous route, or through the direct mucosal contact. So when it comes to the lymphatic route, so lymphatic routes is responsible for the pyogenic forms of it, and the hematogenous route, the spread, if it is through the hematogenous route, it is mostly seen in the cases that are associated with tuberculosis, and it can also be seen that the spread of the pelvic inflammatory diseases is through the direct mucosal contact, such as in the cases of sexually transmitted diseases or pyogenic endocervicitis, endometritis, and endosalpingitis. So actually in such situations, the spread of this pelvic inflammatory diseases can be there in all the three routes, that is the hematogenous, the lymphatic, and the direct mucosal route. So then you look at the classification of pelvic inflammatory diseases, they can be broadly subdivided into two. That is the pelvic inflammatory diseases, they can be classified into acute salpingitis when it is a short-term inflammation of the fallopian tubes. It can be pelvic cellulitis, in the pelvic region there is cellulitis can happen. Apart from this, there can be pelvic abscess, the tubo-ovarian abscess. As apart from this, there can be purpural infections, and it can also arise due to post-operative complication. So this pelvic inflammatory diseases, they can also be there in the post-operative situations as well. Apart from this, the infections what are associated with abortions, so abortion associated infections and secondary to other infections such as appendicitis, diverticulitis, and tuberculosis, these have also been attributed for causing this pelvic inflammatory disease. So viewers and students, this was a very short discussion where I've tried in simple language, in simple terms, I have discussed about, that is, what is the pelvic inflammatory diseases, the etiology, which women are at the greater risk, who are at a decreased risk, the organisms involved, the spread of the pelvic inflammatory diseases, and the classification. In the upcoming videos, I'll be dealing with the next part. So stay connected. If you like this video, give this video a thumbs up, and students and viewers who are new to my channel, who haven't subscribed, subscribe, and do press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.